Hi, everyone. Today we thought about reintroducing ourselves and our program. So, I'm Dr. Rebecca, a family doctor and an obesity medicine specialist in Montreal.
I'm Dr. Vanessa, a pharmacist with a clinical focus on longevity, metabolism, and functional wellness.
And today we're going to talk about the common mistakes we see our patients make and how it could help you avoid these mistakes as well.
So, our program basically focuses on the four pillars of health. Like we've talked about a lot of times, we always talk about exercise, nutrition, sleep, stress management, but also hormones. So, a lot of times when patients come to us, it's because they've truly tried everything and nothing has worked. So, the goal of our program is really getting to the root cause of the issue and then assessing our patients to help them get to a healthier weight, but also to live longer and healthier lifestyle.
Because we all know that obesity and being overweight can be the root cause of over 200 diseases, including cancers. So, like diabetes, cholesterol, high blood pressure, heart disease, stroke. By preventing or actually by achieving a healthier weight, we can avoid all of these problems down the line. So, as a family doctor, and yes, as a pharmacist as well, our bread and butter is really diabetes, cholesterol, high blood pressure. And we see a lot of these patients being overweight or even suffering from obesity. So, why not concentrate on the root cause instead of prescribing and serving you medication for these down the line?
The goal of our program again is to like she said, look for the root cause and not just treat the symptom itself. Obesity in itself is a chronic condition, so it should be seen as a treatment that we need to give long term for our patients, care that needs to be given long term for our patients, because a lot of times it's not just about eating less and moving more. There's more to it. It's more complex, and it's really individual to each person, which is why at our program, we really look at the person as a whole and have a more holistic approach rather than just treating the number on the scale itself.
Yeah. So how about let's go over these four pillars. And like we said, so nutrition, exercise, sleep, and stress management. And we all know that hormones can affect all of these pillars. So when we talk about nutrition, Vanessa, what is the most common mistakes we see our patients make?
Well, a lot of times when patients come to us and we discuss nutrition, they often tell me, I don't understand why I'm not losing weight. I'm not eating that much. I'm eating about 1,200 calories a day. I track my calories and I still can't seem to get the weight off. So when we have a more thorough discussion about nutrition and we actually break down the macronutrients, most of the time patients that come see us are under eating on protein, a lot of times overeating on carbs. So the protein to carb ratio is off. The calorie intake is off. So if you're eating about 1,200 calories a day, for most people, depending on your basal metabolic rate, but again, for most people, that's too low. So what you're doing is instead of supporting your body and fueling your body sees this as a stress and goes into survival mode. It thinks that there's no fuel or food source coming in, so it really puts the brakes on your metabolism, which is why
Conserve energy, right?
exactly. So it's important to, when we're tailoring a nutrition plan for you, it's important to really look at your basal metabolic rate and the amount of energy you're consuming throughout the week. So this is a specific calculation that we do at the clinic, and we use the in-body because that's going to really tell us about your body compositions. Again, it's not just about the number on the scale. We really want to see how your body is working, how your basal metabolic rate is, what your muscle mass is, your skeletal mass, your water weight, your visceral fat. So all of these are going to give us more intel so that we can create a plan that is tailored and individualized to you and your needs.
Another common mistake that we see at the clinic is that patients often have tried many diets in the past and they just cycle through different diets. So obviously they go on social media or they go on YouTube or Google and see the new trend of diet and give it a try because that they think that that is the diet that's going to help their body. But after they've tried it for let's say a couple of weeks or months, they do see a weight change, but often it is not sustainable. So we have a lot of patients, for example, who have tried Weight Watchers in the past, intermittent fasting, the keto
Keto, the
diet,
Jen Atkin diet.
there's a lot of different diets that people have tried and throughout the last 20 to 30 years have cycled through different ones, but have never seen the results stick. So that is another thing that we work on. The plan that we give you is going to be something that looks like what you eat on a daily basis, but with different tweaks and swaps to help you, like we said, boost protein and make sure that your protein to carb ratio is more accurate. So nowadays, research shows that the protein to carb ratio is 1 to 6. That means we eat 6 times more carbs than protein. What we're trying to aim for at least is a 1 to 1 ratio. So eating as much protein as carbs. So lowering our carbs, but increasing our protein levels. Another thing that patients often mistake for is that obviously fruits and veggies are carbs as well. They are good carbs. We are not saying not to consume fruits or veggies. However, some fruits have a very high glycemic index and have a to fiber ratio that is off as well. So, for example, grapes are very, very high in sugar and low on fiber. So, the swaps that we try to suggest to our patients is obviously have your fruits, they are rich in antioxidants. We want you to have those micronutrients as well, but to make sure that we're having the right type that is supporting your body.
And also, it's all about portion game. So at the end of the day, we're not telling you don't eat that banana, don't eat that apple, but understanding that that one full banana or that one full apple, what is that gonna give you? That's gonna give you a higher carb ratio, but your protein is often lacking. So a lot of times when I ask patients about how many meals they're having, how many snacks they're having, a lot of times it's I'm having 2 meals a day. My snack consists of a cheese stick and an apple. You're having your carb, you're having your fat, there's no protein there. So again, it's really easy to overdo it on the carbs because honestly carbs are everywhere, but we talk about protein a lot because it's the hardest macronutrient to kind of achieve. So most people have a hard time achieving their protein intake or their protein target. So that's when it becomes important. Another thing to realize also is when we're talking about increasing metabolism, we need to increase muscle mass. That is a non-negotiable. Studies show that with age, your muscle mass declines. That's a natural biological process. So you have to do anything that you can in your power to kind of counteract that. And there's ways to do it. Obviously, eating a high protein diet, but resistance training. So I've seen a lot of trends, on social media talking about other forms of exercise, whether it's yoga, Pilates, and we have a lot of patients that actually incorporate these as well. However,
And they are great, by the way.
they're very good, but it has to be accompanied with a resistance training program. So resistance training should remain the basis about 3 times a week. But if you want to add on yoga, Pilates, that's really good for engaging your core, making sure that your posture and your form is good. But you have to have some form of basis of resistance training because if we're not challenging those muscles, they will not grow. And we need muscle growth because that is what's going to protect us. Muscle is the organ of longevity,
Yes.
right? So the more muscle you have, the longer you're going to live a healthier lifestyle. And also with menopause, what happens is estrogen drops, and with estrogen drop, muscle mass drops, which is why a lot of women at that age have a harder time to lose weight because again, there's less muscle, metabolism is slower. So the way to counteract that is really focusing on strength training, getting stronger, challenging yourself, progressive overloading, and also making sure that you're fueling your body properly with a high protein diet.
And like Shad mentioned, we do lose muscle mass with age as of the age of 30. So every decade, we lose around 8% of muscle mass. So this is if you're not incorporating strength training in your everyday life. So just imagine that you're losing muscle mass with age. Now there's hormonal changes that come in after the age of 50 years old, and then your muscle drops even more. Muscle, like she said, is the organ of longevity. We need to maintain and even increase our muscle mass in order to support our metabolism, support our hormones, support our overall health, support our bones. So in order to avoid having fractures when we're older, in order for you to be able to get out of your chair when you're 70, 80 years old, to avoid having osteoarthritis, to avoid having back pains, to be able to play with your kids and your
Be
grandchildren
more independent
independent.
and maintain your dignity with
Yes,
age.
we've all seen our parents, grandparents go through a lot of things in their lives, right? We just, blame it on normal age. But what if you started right now to incorporate strength training in order for you to avoid these problems down the line? You would be a winner down the line for sure.
And another thing we talk about at the clinic a lot is sleep. So a lot of times patients come to us, they tell us, I always feel fatigued, I'm always tired, I'm sleeping 8-9 hours a night, I don't understand what's going on. But once we actually dive into it, we do realize that there might be a sleep breathing disorder. Oftentimes that is misdiagnosed or underdiagnosed. Dr. Rebecca here actually does work at a sleep clinic as well. So she is really specialized in being able to detect sleep apnea, which is a sleep breathing disorder, and also treat it, because studies do show that if you have undiagnosed or untreated sleep apnea, it does affect your metabolism, because you have a quality of sleep that is affected. And when your quality of sleep is affected, that does affect your hunger hormones, your satiety hormones. So they're all over the place, which then makes it that you have more cravings for high sugary, high fat foods, and again, does play a role in weight loss as well.
Of course, we have a lot of patients. Honestly, some people have a hard time believing me when I tell them this, but if ever you don't have a good quality sleep, not only so there's good quality and good quantity sleep. So right off the bat, if you don't have at least 7 hours of sleep, we have to fix that. And I understand for a lot of people, especially those who have kids, it is very hard. So we really have to work on our sleep hygiene for that. But now I'm talking about sleep quality. So if you're having your 7 to 9 hours of sleep, but you're still waking up tired, or you wake up throughout the night often with no reason, or you wake up often to pee, if you snore, if you stop breathing at night, if you wake up with a dry mouth, if you're very sleepy throughout the day, or if you wake up in the morning and you feel unrested, like you haven't slept all night, if you wake up with a headache, there's a lot of subtle and not subtle signs of sleep breathing disorders. And it's not only sleep apnea, there's other types of sleep disorders that can impact your metabolism. So it really slows down your metabolism. So I could do anything in my part. I could give you, weight loss medication. We can work on your diet. We can work on exercise. We can work on stress, everything. But if we don't work on your sleep quality, it's like swimming against the current. We're not going to be able to help you more. So sometimes in these patients, we actually require sleep tests, either at home or in a sleep lab, to make sure that we rule out any type of sleep breathing disorder that is impacting our weight.
And the signs and symptoms are very different for young people and older people. A lot of times when you think about sleep apnea, we think about this overweight person that is probably middle-aged, has, visceral fat or fat around the neck. But that's not always the case. Young people can also have sleep apnea. You can have someone that's fit that has sleep apnea as well. So it's important to really look at the signs and symptoms and pay attention to them and not neglect them, because then, like she said, it might create barriers and obstacles when we're trying to create weight loss or just general wellness program for you as well. One of the other pillars that we talk about a lot is stress and hormones. So stress and hormones are obviously interrelated. A lot of times when patients come to us at the follow-ups, we always talk about stress. I always ask them, how's it been going? What's your current stress level? If you have to rate it on a scale of 0 to 10, 10 being the most stressed and overwhelmed you've ever been. So a lot of times, some patients tell me it's a 7 on 10, an 8 on 10, and then we kind of navigate through some stress triggers and see how we can manage stress. Obviously, the first step for stress management is doing things that allow you to disconnect from or decompress from the stress. Some people it's meditation, some people it's journaling, some people it's drawing, painting, whatever it is. Exercising as well, walking. But if the stress is unmanageable, obviously we know in life there's things we can control and things we cannot control. But if the stress pours into other aspects of your life, your personal, your work life, your relationships, social context, that's when we really need to work on it. And when we say work on it, again, we're health professionals, but we also work with other professionals to help better our patients, whether it's a psychologist, talking to someone about it. In certain cases where it's very severe, sometimes medication treatment is required, but it's never obviously the first step. So, as health professionals, we look at all of these pillars because we understand that all of these play a role when it comes to weight loss.
And also, sorry, just for stress management, one other thing to think about. So, how does stress impact our weight? So, there could be a couple of ways. So, obviously, when we talk about stress, we talk about our stress hormone, which is cortisol. Having cortisol spikes throughout the day is normal, it's healthy. But when we have a chronic exposure to cortisol, that's where it starts affecting our metabolism and our weight. Other times, stress impacts our eating behavior. So, we can have stress eating, emotional eating behaviors. Other times, when we talk about stress, we have patients that have struggled with weight all their lives, and food has become some sort of a comfort for them. This sometimes goes beyond what, as a family doctor and a pharmacist, we're able to suggest and handle. So that's where we really talk and refer patients to therapists, especially therapists who are specialized in eating disorders, because just going to the root of the problem of why is food my comfort? Why do I have this type of addiction? This is really what's going to help our patients break the barrier. And we won't just be another program that they've tried without addressing the real problem of the role food plays in their lives. So this is a non negligible aspect of stress management.
And undoing these patterns take time.
Yes.
So again, like we talked about it, obesity is a chronic condition. It's not something that you could do a 6-week program and lose all the weight and keep it off. Most of the time, if someone is offering you this kind of program, see it as a red flag, because we tell our patients from the get-go, it's gonna take time. You have to be patient. You have to be consistent, because again, sometimes it's the mental aspect of it. Sometimes physically, there's a hormonal aspect to it as well. We have to address all of these things. When we also talk about stress, we also talk about hormones with our patients. Sometimes patients going through menopause are on hormone therapy, some are not. So we have to address the hormones, and we have to also address their impact when it comes to weight loss. When patients come to us for a first appointment, we normally suggest a full blood panel. So we're looking at everything. We're looking at your thyroid, we're looking at your blood count, we're looking at your cholesterol, your iron. If you're pre-diabetic, we're looking at, again, your hormones. There's testosterone, progesterone, cortisol, estrogen. So all of these things are going to give us a better look at what's going on. So again, the goal of our program is to make it as complete as possible, to look at our patients as a whole and really address the problem head on, so that we don't just become another weight loss or diet program that you've tried. We want this to be for life. This program is for longevity. We want you to have a healthier, longer life. We want you to enjoy life with your family, your loved ones, your kids. And by doing so, we have to address all of these issues together to make it more complete.
So if you have any questions, don't hesitate to write to us, call the clinic, or book your first assessment so we can really dig into what's been happening, how we can help you, and create a program that is tailored to you.